Hello everyone, welcome back to our next recall session. So today we're going to discuss with you about the anatomy recall questions of NEET-PG 2023. So let us start discussing the questions. So the first question is a defect in which of the following forms the structure marked below? The structure marked below is deep inguinal ring. In deep inguinal ring forms due to defect in the fascia transversalis. So the answer here is D, fascia transversalis. The next question is a student had his jaw locked when yawning. Which of the muscles is attached to the articular disc of the temporomandibular joint? The muscle attached to the articular disc of temporomandibular joint is lateral pterygoid. So the answer here is A, lateral pterygoid. The next question is identify the structure in the following histological image. So this structure is actually the rounded tuft of anastomosing capillaries lined by fenestrated epithelium. So this structure is actually glomerulus. So the answer here is D, glomerulus. The next question is injury at which of the following marked sites causes failure of dorsiflexion? So let us first label these all sites. The first one is lateral condyle of femur. The second one is head of fibula. Third one is neck of fibula. And the fourth one is tibial tuberosity. Okay. So dorsiflexion is actually done by common peroneal nerve. And common peroneal nerve passes through the third structure that labeled in this image, that is neck of fibula. So the answer here is A, common peroneal nerve, third labeled site at which it passes. And common peroneal nerve is also known as common fibular nerve. Let us move on to the next question. A defect in which of the following aortic arches causes the defect shown in the image? This defect shown in the image is patent ductus arteriosus, and which is seen due to the defect in sixth left aortic arch. So the answer here is D, sixth left aortic arch. The next question is which of the following structures develops from the structure marked A? So the structure marked as A is allantois. The distal part of allantois forms urachus and which will form median umbilical ligament. So the answer here is B, median umbilical ligament. The next question is a patient comes with abdominal pain, jaundice, and portal hypertension. Anastomosis between which of the following veins is seen? So this is the case of portal hypertension. Let us look at the options and then decide what can be the answer. So the first option is left colic vein and middle colic veins. This is not the answer because between these two veins, the anastomosis is not seen. The next option is esophageal veins and left gastric veins. This one is completely true because in portal hypertension there is anastomosis between esophageal veins and left gastric vein is seen. So this is the answer. The next option is superior rectal and phrenic vein. This type of anastomosis cannot be formed in portal hypertension. And then last option is sigmoid and superior rectal veins. This is also the false statement because this kind of anastomosis is never seen in portal hypertension. The next question is a patient presents with swelling under the left ear lobule and complains of pain. Which of the following structures is the likely cause of the pain? So here scenario is suggesting of swelling under the left ear lobule and complaints of pain. This is actually seen in the parotid region. Okay. So pain in parotid region is most likely due to involvement of greater auricular nerve. So the answer here is B, greater auricular nerve. So with this, we complete our recall session. So thank you so much for watching and see you in the next one.